My client called an 800 number Medicare ad and it cost her $3,276. There's little doubt you've seen those Medicare ads on TV. There's also a good chance your phone rings every day with someone pretending to represent Medicare or Social Security and telling you that you should upgrade your plan. Or you received a letter in the mail trying to make you believe that you are missing out on Medicare benefits. I'll be honest, I am dumbfounded that people continue to fall for these advertising and sales schemes year after year. After all, by now, everyone should know not to answer a call from an 800 number or even a local number if you don't know who is calling. And you certainly shouldn't give your Medicare information to anyone who calls you on the phone that you don't know. The government has tried to warn Medicare beneficiaries about scams and telemarketers for years. Medicare and Social Security will not randomly call you to discuss your Medicare insurance. Consumer agencies have tried to warn seniors for years to be careful, but lo and behold, countless seniors and Medicare beneficiaries are scammed and misled every single day. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and helping people like you in numerous other states as well. If today is your birthday, then happy birthday to you. Woody Allen said, "You can live to be 100 if you give up all the things that make you want to live to be 100. So recently a client of mine who's been with me for 13 years called and left me a message. She said she was confused why her provider was having issues with billing her Mutual of Omaha Medicare supplement. In her message, she mentioned that they were billing Humana instead and that she had been diagnosed with breast cancer. Before I could return her call later that day, she called Mutual Omaha and canceled her supplement. Oops. Knowing what had happened without even talking to her, I called her back and clarified some things, and she confirmed that she called some 800 number ad on TV last year and signed up for a Medicare Advantage plan. So I explained to her what she did and what it meant. Of course, she had no idea. The wonderful people with the telesales insurance company didn't bother explaining to her that her Mutual Omaha doesn't work with Medicare Advantage, and I pretty much guarantee they didn't go over all the pros and cons of Medicare Advantage and explain the very clear differences between a Medicare Advantage plan and a Medicare supplement. They just hyped all the extra benefits like dental, vision, and of course the grocery cards. After our initial talk, I got on the phone with Mutual Omaha and explained to them what this poor lady did and had her policy reinstated for her. That is not something an 800 number telesales agent would do. Then I scheduled a time to meet with her to figure out exactly what she had and didn't have. After all, she had a bunch of expired insurance cards and she had no clue what she had and didn't have. Before I keep going, if you are finding this info valuable and don't want to miss out on other videos that will warn you and inform you about your Medicare options, you can go ahead and subscribe below. When we met, I explained to her why in her case she should drop her Medicare Advantage plan and go back to original Medicare. She had a recent cancer diagnosis, and keeping with Medicare and her supplement would eliminate all the co-payments she would have had with her Medicare Advantage plan and reduce the likelihood of any treatment being denied coverage. To get her back, I simply enrolled her into a Part D drug plan that was well suited for her and told her that would automatically cancel her Medicare Advantage plan at the end of the year. In the end, because my client kept on making her $273 per month premium to Mutual Omaha and received no benefit from it, in the end, by her calling one of those wonderful 800 number ads, she lost $3,276 in premiums. She also paid co-payments out of her pocket that she would not have had if she kept original Medicare instead of switching to a Medicare Advantage plan. All told, she's probably in for over $5,000. The good news with my client is that number one, at least they had her get a Humana Medicare Advantage plan with a relatively low out of pocket. Number two, she finally called me desperate for help. And three, she didn't lose her supplement in the end. I do want to say that this is not a bash on Medicare Advantage plans. After dealing with thousands of Medicare beneficiaries over the last 13 plus years, I have found that Medicare Advantage plans can and do work well for many people. The problem is most people have no clue what in the world they are, how they work, their pros and cons, and exactly what they are getting into, and no one should drop their Medicare supplement for a Medicare Advantage plan unless they truly understand the benefits and potential pitfalls from doing so. One final thing, I suggested to my client to have her daughter call me so I could explain to her what had happened, and also told her to have her provider call me if they had any questions. Well, a little while later, I got a call from someone in the claims department for Centera Health to find out what was going on. I explained to her what had happened, that they needed to bill her Medicare Advantage plan through the rest of this year and then start billing original Medicare and her supplement starting January 1st. This lady in claims was very nice, but even she had no idea how Medicare Advantage and Medicare supplements don't mix. And this is a person in claims with a hospital group that also happens to have their own Medicare Advantage plans. If it's confusing to her, imagine how bad it is for many seniors and Medicare beneficiaries. And by the way, I have numerous other horror stories from clients who have called an 800 number or answered a telesales ad. Perhaps I'll start a series on the topic. If you have a genuine horror story, post it in the comments below. Just make sure it's clean and non-offensive. You can watch one of my first videos called Don't Be a Fool that explains why you should avoid the Medicare ads on TV. If you need my help choosing and enrolling in a Medicare plan, and you are from one of the states that I'm licensed in, then please reach out to me. You can go to my website. On there you'll see a couple contact pages. Just click those and fill out the information. If you happen to live near the Charlottesville, Virginia area within an hour to an hour and a half and you would like to meet in person, then please reach out to me and we can probably work that out. Lastly, if you found this video helpful, please consider giving it a like. And who do you know who could benefit from this info? Please consider passing this on to someone you know. Oh, and please don't be suckered into the Medicare ads. I'm Chris Prang, the Medicare analyst. Make it a great day.